Mandana ma'am, you are mute.
I do all the time. Thank you for reminding me. Okay. Yes. Greetings and welcome to Oral Pathology 360 channel, where we aim to focus on oral pathology as a specialty and within the broader context of dentistry and patient care. Now, I'm still mute. How am I mute?
No, we can hear you, ma'am.
You are
Yeah.
not. You are not mute.
Yeah, I know. It takes a little lapse. Don't worry about it. Okay. Yes. Greetings and welcome to Oral Pathology 360 channel, where we aim to focus on oral pathology as a specialty and within the broader context of dentistry and patient care. Sorry, I seem to be hearing my own voice back, so I'm just going to take this off. Now, of course, I'm Dr. Mandana Donoghue, founder of Oral Pathology India and media partner of Oral Pathology 360, and your host for today's Research Hour live stream. Channel, where we aim to focus on oral pathology as a specialty and within the broader context of dentistry and patient care. Okay. Sorry for this little bit of confusion in the beginning. Sometimes it happens. But now we're in a world where academicians and researchers face a publish or perish situation, and clinicians are faced with daily changes of what's right, what is wrong, what is in, and what is out. And how do you choose? The ability to review and rank information based on supporting evidence and possibly adding to the volume of curated evidence-based information through systematic reviews is as important as the public training we receive in our original degrees. Now, today we have with us a very well-known name in the world of evidence-based research, Dr. Priyanka Kapoor, to share her journey and experiences in reviewing the systematic way. Dr. Sachin will be, of course, sharing the formal introduction later, but I'll start by just saying that she's so totally dedicated and passionate in her pursuit of excellence in research that you will find it almost impossible to not be charged by her enthusiasm. That's the effect she had on me, and I'm sure you will be able to sit back and enjoy and learn quite a bit. We also have Dr. Sachin Sarode to moderate the session. Now, I have to say, I didn't even know him till last week. He's another amazing person I have had the pleasure of meeting through the series, and of course, thanks to Dr. Sandhya. He is professor in the Department of Oral Pathology and Microbiology at Dr. D.Y. Patil Dental College and Hospital, Pune. He holds a PhD from the same institute. He has received over 20 awards, including the prestigious Fulbright Nehru Doctoral Research Fellowship Award from the Ohio State University, USA, and an award for outstanding research faculty by the hands of Honorable Union Minister, Human Resource and Development, Government of India. He is a prolific author, both of book chapters and over 300 articles. He has received more than 2,000 citations. He has 8 patents and 6 copyrights to his credit. The patent on metabolomics purification system has been adopted worldwide. He is the managing editor of Journal of Dental Research and Review and the editorial board member of 11 international journals. We also have an expert, as usual, someone who will give us a little more insight, a little more discussion, and just makes the whole thing a lot more lively. He is an orthodontist, a clinician with an academic bent of mind. Dr. Singh is a fellow of the Royal College of Surgeons, London, as well as the Royal College of Physicians and Surgeons of Glasgow, and a diplomat of the Indian Board of Orthodontics. He has numerous national and international publications and has authored 2 books, the Textbook of Orthodontics and a mini atlas on orthodontics. He's an internationally recognized speaker, also the former editor of the Journal of Indian Orthodontic Society, and an executive member of the Delhi Dental Council, Indian Dental Association, and the Dentistry Sectional Committee, Bureau of Indian Standards. Thank you, sir, for being here with us. But we also have some more guests today. Now, I ran this thing to let everyone know who was particularly interested that they could RSVP and that we would choose 3 of the people who filled the form. But it caused a lot of confusion to begin with. But anyway, we have managed to successfully get the forms. And Dr. Priyanka herself, I mean, very at random, I called her up and said, choose three numbers, and she chose three numbers, and they are with us. So we have Dr. Purohit, Dr. Palaskar, and Dr. Sharma with us. And I hope they will all benefit from interacting with the panel directly. So with that, I think I should welcome everybody, and I request Dr. Sarode to please introduce the guest speaker and start the session. Thank you.
Thank you so much, ma'am. It
You're
is indeed a
welcome.
privilege for me to introduce. It is indeed a privilege to introduce Dr. Priyanka Kapoor. She is a professor and in charge, Department of Orthodontics, Faculty of Dentistry, Jamia Millia Islamia, New Delhi. She is an avid academician and researcher with primary interest in evidence-based research, biological mediators, obstructive sleep apnea, and forensic age estimation. She has won prestigious awards, including International Moyers Symposium Award, Michigan, USA in 2014. And her research interest in sleep apnea won her research grant, 3M Unitake iOS RF Research Grant 2020. And also, she led her team to develop an award-winning mobile application, OSA Risk Assessment Tool in 2020. She has co-authored and authored over 30 publications, including many systematic reviews and scoping reviews. And she has reached out to the scientific community and the student, both nationally and internationally, with many workshops, lectures in her areas of expertise and interest. I personally believe that the topic she has chosen is related to the systematic reviews and the scoping reviews. In today's time, when the clinical material is not available, in today's time, when the wet lab research is not possible, it is very important to focus on the research which is based on a dry lab, which is based on the database. And today's topic about the systematic reviews and the scoping reviews and other reviews, they are basically based on the dry lab research, wherein we can retrieve the data from different databases and we analyze them systematically. And if you see the the um, the level of evidence in the paper, the systematic reviews, meta-analysis, they are at the topmost position. So with this, I welcome Dr. Priyanka Kapoor, and I request her to start with her lecture. Thank you.
Yes, may I request everyone else for the time being to turn off mics and cameras so that.
Is my screen visible to all?
Yes, yes. Yes, ma'am.
Okay. Thank you, Dr. Sachin, for a wonderful, wonderful introduction. And at the onset, I would really like to thank Mandana ma'am for giving me this opportunity to feature in her extremely popular YouTube channel, or Pathology 360. And she has invited me to share talk on systematic reviews, which is not only research for me, it is a passion for me, which I have developed over the years. And besides, I'm so happy to have Dr. Gurkeerat sir as my expert today. He's an avid academician par excellence, and he's so popular among students with his books. All our students read his books, so I'm really happy he's here today. Dr. Sachin, I do not know him personally as yet, but our academic community and the scientific community has become so small with all the social academic platforms, and I have gone through his immense amount of volume of impressive work. And so I'm so happy he's here. I'm so happy my guests are here, Dr. Manusmriti, Dr. Mohit, and Dr. Sangeeta. So I really, I'm so excited about this talk, not only to deliver, but to take back so much from the discussion that we are going to have. And regarding our audience, because it's very, very varied, and we might have students who do not know what study designs are. We might have some faculty who has done research but has not ventured into evidence-based research. We might have some researchers who are already doing systematic reviews. So looking at the variety of the audience, I have kept something for all, and I do hope it helps. But definitely, learning is a two-way process, and I do hope that the discussions are going to continue, and we are all going to benefit from it. So, as my disclaimer, I definitely do not claim that I know everything about the subject. Everything that you see in this presentation is just based on my personal experience and obviously the sound scientific literature. But I will also make an effort to learn more when I go from here. So basically, my contents will be divided into types of evidence, quality, what, why, and how of systematic reviews, and applying these skills in multiple dimensions and with a tweak. Because I don't usually study all these things very, it's not very dry for me. So I formulate some stories within myself. So you'll see those stories. Some will be hypothetical and some will be my own. So let me take you to a journey with me. So how do we classify research in a scientific manner? So we can explore the unexplored, or we can explore the explored. This is two basic criteria. But if I start explaining the study designs, I don't think you'll get too much. So let's start with the story only. So there is this patient A who is noticing that his gums are going slightly down and his teeth are elongating, and he's having slight sensitivity for hot and cold. So he decides, okay, let me go to a dental institute and get myself checked. So he goes to a dental institute. Now he's referred to the perio department. He gets himself registered in the perio department. There, his case is assigned to a first-year postgraduate in periodontics. He looks at the case, he discusses with his guide, and they decide, okay, let's go for gingival graft. They do a gingival graft, they follow up the patient, and the patient turns out to be really nice. The treatment turns out to be very nice. So now the guide tells this resident A that you prepare a case report. So he prepares a case report, it gets published, end of the story. No, the story doesn't end here. Now he notices, this resident A is working in the same department. He notices that over a period of time, similar cases are reporting to the department time and again. And he's treating them with the grafts. So he talks to his guide, why not combine all the cases? So they combine all the cases and they present as case series. Okay, very good. But then, now since the volume of cases is increasing, similar cases of gum recession, so now they decide, okay, let me look back. Let me look at the history. Let me see if there's any common associating factor with it, maybe some habit or trauma from occlusion or any such thing. So they go back and they look for association. So they plan their study as a retrospective cohort study. But now resident A is not satisfied. He says, I am going to continue these patients of gum recession for next 1 year, and I'm going to see what is the prognosis of my treatment in these patients. So now he has planned the study as a prospective cohort study. Done. But then they start noticing that these gum recession patients are falling into two categories, basically. One, which have adequate attached gingiva, and the second group, which does not have adequate attached gingiva. So now the guide tells resident A, let us give them two different options of treatment. So one with adequate attached gingiva undergoes flap surgery, and which doesn't have adequate attached gingiva undergoes a free gingival graft. So they have planned a clinical trial, but this is a non-randomized clinical trial because it can't be randomized because their inclusion criteria is different. But then this guide says, okay, but I'm having lot of cases which are having recession, but they have adequate attached gingiva. So let us try two different options of treatment on these patients. Let us plan this trial as a randomized clinical trial, RCT. Okay. So now how do they do this? Patients are reporting to the department with gingival recession. They have adequate attached gingiva. Now they are given two different options. One is coronally position flap or the flap surgery, and one is this flap surgery along with PRP or any other, maybe the growth factor or anything. So they plan it like that. But how do they control the bias in this? By randomly allocating the patients by a random sequence generator. So they have reduced that bias. Nobody knows it. The number is coming randomly by a sequence generator. So they are assigning the patients based on that. There is allocation concealment because the patient will not come to know what surgery he's going to have, whether he's going to have a flap surgery or he's going to have the option to flap surgery plus PRP. So, and it has come in an envelope which is sealed. So when the operator opens the envelope, only then he comes to know what surgery he's going to perform. They also plan that we are going to reduce the attrition bias in this case because they are going to follow up the patients and see which patients, they don't report or due to any reason they discontinue the treatment. So they also report the attrition bias. So you see, they have designed a very good randomized clinical trial and they have pre-registered in national registries like CTRI, which is Clinical Trial Registry of India, or a US site, which is clinicaltrial.gov. So now the guide is very happy. Okay, we have done a great job. We have planned a randomized clinical trial and we have registered it. And now we are starting the, taking the patients in this trial. So he's happy about it. But this resident is thinking, maybe there's any other option also, which is better than this option, these two options for such kind of patients. But how do I come to know about it? Because I am working in this institute and this is a trial which I have planned in my own institute. There may be other trials on the similar cases which are happening in other institutes all across the country, all across the world. So how do I gather the data from there? And how do I come to a conclusion, okay, this is the best treatment option for the patients? So that is where the secondary research comes into being. As Dr. Sachin just mentioned, the dry research comes into being. So now the importance of systematic reviews and quantitatively analyzing all the results of the studies which are present based on the quality of those studies, statistically analyzing it will give results in the form of meta-analysis. And the systematic reviews and meta-analysis that are generated based on the type of the clinical trials that the resident A has registered, they are very high quality evidence. So that's what we have to learn. So the levels of evidence, if we talk about now, see, the resident A climbed up this ladder in the very similar manner. So if you go at the bottom of the ladder, he did a case report, then he combined and he did case series. Then they planned it as a retrospective cohort study or a prospective cohort study. Then they planned it as a trial. Earlier, they planned it as a non-randomized trial, but then they escalated their evidence to a randomized clinical trial, which was pre-registered. And then they took out the data from all the trials and all the evidence which is present related to that particular problem and generated a systematic review and meta-analysis, which became the highest quality of evidence. So this story is going to come again and again during my presentation. This is how I learn things, so I feel it becomes simpler to understand all the study designs and everything based on the story. So the dogma of clinical decisions, okay, this is the best way. Now, if a gum recession, gingival recession patient comes and the guide is just knowing one treatment option, he will say, okay, this is the best way. That's the dogma. Traditionally, he can also say, okay, flap surgery is the only surgery that we do in such kind of patients. That's a traditional surgery. Conventionally, he can say, okay, everybody does this flap surgery, so you do a flap surgery. That's conventional. But since the resident A is so smart, he says, I want evidence that this is the best treatment option, only then I'm going to give it to the patient. That should be the proper approach. Because all this effort is actually to make life easier for the patients, to have the best healthcare interventions for a particular problem, and supported by the scientific evidence. So how does the sequence move on? First, we have generated the evidence, like our resident A. Then they have combined that evidence and they have analyzed it systematically. They have generated a systematic review. Then how does the systematic review become important? One is that obviously you have to use it in your clinical practice, but then it also helps the government agencies, the health-making, policy-making agencies to take up the best quality of evidence and divert their resources, their money, their expertise into those decisions. As you all have seen, the past few, I'm like 1.5 years has been an infodemic time, and it's actually an infodemic because whatever related to pandemic is coming, it is coming in huge volumes, and we have overabundance of information. One day, somebody can have one public opinion, the other day somebody can have the other public opinion. So whom to follow? That's why this becomes so important. There's so many studies that ICMR has published where they say that remdesivir is not good. It's not showing any effect. Ivermectin has 78% more efficacy in controlling the mortality. But how do they come up with this? They only come up with this because they have good quality evidence and systematic approach to support this evidence. And then how are you going to apply it on your patients? Well, that's what evidence-based healthcare is all about. I am an orthodontist. A patient can come to me with a class 2 where he can have a maxilla protruding out or the upper jaw protruding out and the lower jaw backward. And I may be comfortable with just doing the upper premolar extraction and taking the teeth back. So I give that option to the patient. But now the patient is very informed. He says, why have you not given me the other option? Why didn't you tell me that there's another option of functional appliances also, that I can be helped by that and my child may not have to have his teeth extracted? So, then I have to support my treatment option with the right kind of evidence. I have to show the patient that in your case, this will not work because your VTO is not positive, or maybe whatever the reason is there. So I have to show the evidence to the patient. Only then we can reach to a consensus. So the evidence-based healthcare is standing on 3 pillars. One is the clinician's expertise, one is the patient expectations, and the other is the evidence related to it. So you can see all these circles, and then the Venn diagram has the central area where you work upon the evidence-based healthcare. So what is a systematic review? It's basically a literature review, but with a slight difference. What is the difference? It has a clearly formulated question, research question. It is going to use systematic and explicit methods to identify, select, and critically appraise. We are going to come to the meaning of all of them. So I've highlighted the things which are very, very important to understand in a systematic review, and to collect and analyze the data that are included in the review. Obviously, that remains same for the literature review also. How is it different? It is different basically on 4 basic parameters. One is search, one is appraisal, one is synthesis, and one is analysis. When you talk about a normal literature review that you do, where you collect all the data which is present, which you think is all the data. So now you collect it, but the search there is not comprehensive. You don't know that there are any other articles related to it or not, whether you've collected all evidence or not. So the search is not comprehensive. And how do you appraise in literature review? You do no quality assessment. For you, anything that comes on the screen is worthy of being included in your review, if it's related to your topic, yes. And you synthesize it narratively. And since there is no quality assessment and the search is not comprehensive, you cannot surely present any clinical recommendations or research recommendations based on it. So there is the difference in systematic reviews. It has an exhaustive search. The quality assessment is done. Synthesis is narrative with tabular. You can also progress to meta-analysis. And the analysis can definitely point to future clinical recommendations. So again, let me start with the story. This is my own story. So back in 2012, I'm really interested in biomarkers in tooth movement. It was related to my thesis topic, and I planned to continue it. So I decided that, okay, let me do a huge literature review on biomarkers in tooth movement. So I started collecting evidence related to it. So one day I would sit on Google Scholar and I would type cytokines in tooth movement. The other day, I would type enzymes in tooth movement. The third day, I would type nitric oxide in tooth movement. Fourth day, biomarkers in tooth movement. So the cycle went on, and after 4 months, I got tired. I was doing it alone. I got tired and I thought, okay, this is enough. These studies are enough. Now I should compile and I should present it as tables and separately catalog them into different mediators, and I should send it for publication. I sent it for publication. Now the reviewer comments came back. The reviewer comments which came back, they changed the course of my future working in research. They opened my mind to a whole new arena of structured research, and I will always be thankful to those reviewers. And there I had to trash that literature review. I presented it again. I followed all the protocols and I published this effect of orthodontic forces on cytokine and receptor levels in gingival crevicular fluid, a systematic review in 2014, a PubMed Index journal, Impact Factor journal, and it has crossed 100 citations since 2014. So, if you produce good science, it can also fetch you accolades as a researcher. So let's go ahead and see what my reviewers had pointed out. And maybe some of you in the audience also might be facing the same problems. So let us identify the problems together. They asked me, do I have a clear-cut research question? I didn't have a clear-cut research question because I had a thought in my mind that I'm going to collect all evidence available on biomarkers in tooth movement. I didn't know that I'm going to study in one biofluid. I didn't know that I'm going to study in one kind of orthodontic force. I didn't know that I'm going to study one kind of biomarkers. So I didn't have a clear-cut research question. Did I register in any international database? No, I had not, because I didn't know that there was an international database for registry. Prospero, we will be discussing that. Did I have a predetermined search strategy? Absolutely not. Because one day I was typing cytokines into movement. The other day I was typing enzymes into movement. The third day I was typing something else. So I didn't have a search strategy in my mind. That was one more drawback. Did I have a time frame in my mind? Of course not. Because 4 months was the time I allocated to my own self. Okay, now I've become tired, so I'm going to collect all the evidence and I'm going to present it. That's not how review works. Did I look at the quality of evidence? Did I look at the quality of studies? Okay, since I've been working in the clinical area, so I was pretty aware of RCTs and the clinical trials, but I didn't know that I had to apply that risk of bias techniques on the quality of evidence, so I didn't apply it. then because the input that I had made was of low quality, so the output that came of that review was of low quality, so I could not suggest any research recommendations. So I corrected each and every point that they had written, and then I remodified it, presented it as a systematic review, and then it got published. So that I've already shown you. So this is the basic protocol that all of us have to follow. This is a mind map of systematic reviews, a basic mind map. I'll also be showing you a detailed one. But this is a basic mind map that we follow for systematic reviews. So many of you maybe just at the first step, at the green area, which is selecting a topic. Now, if you talk about my own self in the first systematic review, I already was aware that, okay, I had a topic in my mind that I wanted to do something in biomarkers. You may not have that topic right now. So how you can look for that topic? It can be something which is related to which is being published in your own field. Maybe you're from prostho or from oral pathology or any other branch. So you can go through the last 3 issues of your major journals, and you can see which topic is getting repeated. So people are actually, looking for those relevant systematic reviews to apply it on their clinical practice. So that would be the right area to begin. Plus, you should also have some features of topic in your mind. It should be based on feasibility and relevance. When I talk about feasibility, that means that if I wanted to do a systematic review on mucormycosis, maybe a month back or 2 months back, till that time mucormycosis had not shown its presence in COVID-19 so much, so that we did not have too many clinical studies. So it was not possible, it was not feasible for anyone to do a systematic review in it. But now, 2 months down the line or 3 months down the line, we have a lot of clinical data, and I have seen a lot of clinical systematic reviews in different aspects of mucormycosis that have been registered. Feasibility, relevance. Yes, definitely, because if I talk about mucormycosis, it is relevant in the current times. People might want to know what is the treatment option, best treatment option, what is the etiology, how we can prevent it. So that is relevant for the current times. So the topic, when you choose, it has to be relevant to the current times. So you can choose a topic and progress to the next point, which is very, 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 very important, is formulating the correct team. As I said, when I gave my example, when I was doing a narrative review, I was doing it all on my own. There was nobody to second me, nobody to tell me here, yeah, I'm going wrong. Okay, this is the interpretation that you have made is not correct. So you correct it. So that is why the minimum reviewers that should independently look at all the studies are 2. It can be 3 also, but minimum, it has to be seen by 2 reviewers independently. You don't have to sit in one room and see. Well, that's not a possibility in COVID times, but yeah. So you don't have to be aware of each other's results, and you just have to look at the search independently, the data extraction independently. So that's how you do a systematic review. So let me look at the first team that I had. So this was the first team. Besides me is Dr. O.P. Kharbanda. He was my guide and my mentor throughout. And he was the part of this first systematic review, and ever since. Dr. Nitika Monga, she was a senior resident at that time. So you see, all of us, the first 3 that you see, they are orthodontists. So they are all content experts also for a systematic review. So if I'm thinking of doing a review on effect of orthodontic forces on cytokine levels in GCF, that means my content experts have to be orthodontists because they understand the orthodontic force and methodologies better. But if you look at the 4th picture, that is Dr. Rajeshwari. She was my co-guide during my PG, and she's a professor in biochemistry in AIMS. So she was also included to assess the quality of the methodology that had been taken by the studies when you point out the ELISA or the biomarkers. So she was the expert at it. So you have to formulate a team which is based on your research question. You don't have to include the team just on the basis of your friends and family. No. It has to be totally based on either the content or some specialization, or maybe now, since at that time we did not have the systematic review method experts, but now you can include one of the co-authors who is a systematic review expert, so they can help you during the methodology of the review. Besides, you can also include one of the authors of the clinical trial that you include in your review. It will be very beneficial for studying the methodology. Then we point to the research question. So how do we formulate the research question? Now, as I said, that one of the major points that the reviewers had told me was that I did not have a research question. Then I learned how do we formulate it. We formulate it on the basis of PICO format, which is population, intervention, comparator, and outcome. And can we only do systematic review in one dimension? Like if I'm studying mucormycosis, can I register a systematic review just on mucormycosis in COVID-19? No. There can be so many different aspects in which you can go while registering a systematic review. You can register the etiology aspect of mucormycosis. You can register the treatment aspect. You can register the therapy aspect, prognosis aspect. So many different aspects in which you can register your systematic reviews. So when you're looking for duplication, which is a must when you start your systematic review, you have to go to Prospero or Cochrane and see whether any similar systematic review has already been published or not. And then if you see that, okay, this aspect is already being studied, like they have already mentioned, okay, we are studying the treatment aspects of mucormycosis. So you can take some other aspect, like you can study the etiologic aspects of mucormycosis, because it is all about systematically taking out the evidence and using it for the healthcare benefit. So you can take any aspect you want. So let's look at what our resident A was doing. So he tried to formulate a research question because his area was flap surgery and gum recession. So he wanted the best kind of treatment option for his patients in gingival recession. So what is the question that he formulated? Is coronally positioned flap effective in gingival recession? This was his research question. Then how did he separate or segregate into the PICO format? Population, intervention, comparator, and outcome. So the population in this case were patients having gum recession. The intervention was the flaps, coronally positioned flaps. The comparator was flaps with PRP. And outcomes also, you have to maybe speculate or maybe study what outcomes, primary outcomes you want to study. Maybe one person might want to study the attachment loss in this case. The other person might like to study the sensitivity or the probing depth. Any outcomes, but you have to register those outcomes prior. It is kind of a roadmap that you already should have before you venture on to a systematic review. Besides the primary outcome, you can have some secondary outcomes that can come later on. Maybe you find some association with age or sex. So that is a secondary outcome that can also be there. But if you look at this is where the whole systematic review is going to rest. People are scared, they when they are trying to register the Prospero, they feel that, okay, we're not understanding the questions, they're asking so much. Prospero is basically a prospective registry of clinical, of systematic reviews and meta-analysis. It is NHS initiative. So if you want to register in Prospero, you should already have made a Word document where you have all these parameters which are listed. Which parameters? If you've divided it into PICO format, which is participant, intervention, comparator, and outcome. You have to write the inclusion and exclusion parameters in each heading. That is going to help you in registration of Prospero. Prepare that Word document prior. Like here, if you have gum recession patients, you might want to say that my inclusion is gum recession patients and my exclusion would be any other periodontal disease or gingival inflammation. So that can be your exclusion factor. So you have to write it beforehand. Your intervention can be these flaps. So your exclusion can be any study which is studying the pre-gingival grafts or any other grafts. So your exclusion can be those studies. Your comparator here is flaps with PRP. So you don't want any other comparison in your case. So you can exclude the other, again, gingival grafts or any other grafts. Your outcome here, you want to study is probing depth or attachment loss. So you can leave the exclusion criteria by any other outcomes that you don't want to study. Maybe the psychological aspects or the life outcome aspects. So you can keep it in the exclusion. So you have to prepare the inclusion and exclusion under each heading and prepare a Word document prior, once you finalize your research question. This is how the Prospero registry looks like. You have to make an account in it. It's a free account. So just go to the Prospero site. It's a University of York initiative and Center for Reviews and Dissemination. These are the interfaces that you're going to see. Don't get hassled. It's a very, very simple registration. This first 2 pages, so you'll just brush through because it is just authors and what timeline and time frame and what are the keywords. So all this they are going to register in the first 2 pages. Then the next will come, which are the details about the participant, the intervention, the comparator, and the outcome. So when you register that, and they also will ask you how you're going to assess the quality. So you have to have those quality assessment tools also registered prior in Prospero, which are suitable for your study design. So like our resident A, while planning the clinical trials, was so careful for planning about the risk of bias, the allocation concealment, the sequence generation, the attrition bias. So everything, you have the tools ready for it. So I'll just be showing you one slide about that. So you can go through the article and you can choose which risk of bias tool or which quality assessment tool is going to be most applicable for your studies. So this is how the Prospero registration, once you make an account, since I've registered quite a number of them. So this is how your profile is going to look like on Prospero. Then the next thing that is important is where to search. You have made a protocol, but where to search that? You have to formulate a search strategy and you have to put it on 3 databases minimum. And those databases should not be Google Scholar. I would not recommend going for Google Scholar because it takes up all the fields while it is kind of looking through the evidence. So it will take up title, abstract, the text. So it gives you number in thousands and lakhs. You can't go through that. So you stick to the major databases, which are PubMed, Medline, or maybe Embase, Scopus, Web of Science. So for some, they are freely available, like PubMed is freely available. So you can go through PubMed. Scopus, our university is very kind enough. They have given a subscription for Scopus and also Web of Science, but we don't have a subscription for Embase. But PGI Chandigarh has Embase also. So if anyone has connections there or you can request some researcher there, you can go through the search strategy there also. Besides that, you should go through the gray literature also. So it's not only what is published, but also what is in gray literature. Gray literature, which is basically not published or maybe high level thesis, dissertations. But there is also a site which registers these thesis, which is OATD, which is Open Access Thesis Dissertation site. So you can go to that site. You can also go through these sites, which I just mentioned here. So you can look for good quality gray literature and you can include. Even you can go to the clinical trial registry and you can even mail the authors who are doing the clinical trials. If they have some results, they can share it with you. So you can include all that. Then how to formulate a search strategy? That's very important. You need to be aware that the basic principle of creating a search strategy is Boolean logic. Boolean logic is and, or, and not. So when we talk about and, if I'm interested in studying the effect of coronary position flap in gingival recession, these are two different concepts if you see. Coronary position flap is one concept, which is the treatment aspect. And gingival recession is basically the aspect which you want to study or the participants. So two different aspects you are going to separate by and. But if you have some synonyms or some short forms, some abbreviations, which are pertaining to one concept, like the coronary position flap has some other name or some short form, some abbreviation. So you can separate by or. If gingival recession has some other name like periodontal recession or some short form like GR or something, so you can separate it by or. Preferably, please do not use not, because when you use not, suppose I feel that, okay, I'm not going to study the gingival inflammation. So I'm going to put not gingival inflammation. So all the studies which are studying gingival recession and inflammation, they're going to go from my search. So preferably don't use not, but this is a basic search which I've told you. For the search, it's a whole new workshop and you need a whole new time for it because it's really extensive when you want to formulate a search strategy, because that forms the basis of what evidence you're going to generate. How comprehensive is your search is totally based on your search strategy. So it's very important to spend time on the search strategy. Then once you have put your search on the databases, so then the next step comes that, okay, you've identified the literature based on the titles and the abstracts, and you are screening them on that. And in all the major databases, because you have put it on 3 or 4 databases, so you'll definitely have some duplicates in all of them. So you're going to remove the duplicates. And then after removing the duplicates, you see that, okay, we have screened this. This looks to be eligible. But to find the eligibility, you need full text. Now you gather all the full text and then you see, okay, does this fall into my criteria or not? And then you finally include. That is PRISMA. Preferred reporting items of systematic reviews and meta-analysis. So this is, I've written, the references are written below. So anybody who wants to go and read, most welcome. This is how your PRISMA chart looks like. It is very, very important that you maintain this chart diligently because they are going to be demanded by the manuscript when you submit your manuscript finally. So you see the top section is identification, where you see all the databases, how you screen those based on titles and abstracts. Then you again take the full text and you apply the inclusion and exclusion criteria and you finally include it. Besides this, you also have a PRISMA checklist. So this is how the PRISMA checklist looks like. It's not the time to discuss everything in detail, but yes, these are the parameters which are important when you submit your manuscript for publication. As I said, there can be different risk of bias tools which are important when you study the quality of evidence that you are gathering in systematic reviews. So this is a very beautiful article. They have segregated it into the tools plan for RCTs and for non-randomized studies. So you can look through these tools and you can see which of the tools is applicable to your own study. And majorly for clinical trials, we use the risk of bias, Cochrane risk of bias tool or the JBI tool. So that is there. And now the version 2 has also come of Cochrane risk of bias. But for observational studies or diagnostic studies, we use the QUADAS tool majorly. QUADAS 2 has come. So that you can use right now. They are divided into different domains. So you can study those or we can have a separate time on that. So then once we had done all this, so we started, venturing out and people started connecting to us. And so there was this researcher in CSIR who wanted to do some research in adult obstructive sleep apnea. So what I'm trying to say here is, once you are comfortable with the systematic approach, you have developed that critical thinking to asking the right questions, then segregating them into PICO format, and then registering it into international database, performing the right quality of search, doing the quality assessment of studies. So now your mind is set. So I don't need to restrict myself just for my own branch or discipline. This particular aspect or these skills that you've developed can be used anywhere and everywhere in every discipline. So then this CSIR guy, he started connecting to us and he wanted to do as a PhD topic. So we registered this meta-analysis on craniofacial and upper airway morphology. Again, it has huge citations, crossed 140 already. So you have to do good quality research and also disseminate it. Prospero registration also is done for this basic purpose. One is that you maintain the transparency of research, but then it also says that you have to time and again update what is your stage of research. So it is going to ask you, okay, now since you've done the research, have you also published it? If you've published it, you have to put your DOI or any other identifier on it. So they will not let you stop. Okay, you've just registered and now you can sleep. No, it doesn't work like that. So, and the other systematic reviews also. Now you see, it's very interesting that I also published a systematic review on enzymes separately, because then my review question was so specific, it was just based on enzymes. So recently I was talking to somebody and they wanted to do something very broad, like role of something in cancer. So the role of this is not a good topic maybe, but if you divide it into separate categories, then maybe, you can publish separate systematic reviews. Or if you really want to study that role, then I can tell you how to go about it. Meta-analysis looks like this. We don't have time to discuss everything in detail, but this is how a forest plot looks like when you form the meta-analysis. It includes all the studies and the line of no effect. And finally, the diamond, which shows, okay, this is the final outcome. So what did I learn till here? I developed my critical thinking skills. I knew how to do a database search on different databases. I knew how to register in international registries. I knew what is the importance of a good team. I knew how to do the quality assessment. I knew how to collect the data and how to quantitatively synthesize it. Till now, this is my learning. Then I go ahead. Now, since I've developed those skills and I know that I can venture out into any possibility. So there, this COVID time, we started doing a scoping review, which is much more broader than a systematic review. As I said, when you say the role of something in cancer, you can definitely do a scoping review on it. It does not have very clear-cut research question. It can have a broader research question, but then you can do that as a scoping review. So this was published in Nature Publishing very recently in 2021 in BDJ Open. So this was our first Nature Publishing. We're really happy about it. And this is my team. So my team also got expanded. So we added Dr. Aman Chaudhary, who is Professor in Oral Pathology in my own institute. We added Dr. Deepika, who is again Professor in Oral Pathology in my own institute. So, then you again form the right kind of team. All these efforts are never singular, please. So you have to, even in a scoping review, all the evidence has to be analyzed independently by at least 2 researchers. And then you need to have a third researcher to look at the consensus. Okay, both the researchers are pointing out to the same thing. So there the third researcher comes into play. You can have content experts here. You can have method experts also here, because the scoping review is slightly different from systematic review, but it follows all the principles almost of the systematic review. So let us see where the systematic review and scoping is different. So we had seen this mind map earlier, where we had selected a topic, formulated a team, formulated a research question. We had registered a protocol, but it is not mandatory to register a protocol for scoping reviews. And currently, Prospero is not registering scoping reviews in the COVID times. They have written it on their website also. But there is another open science framework, which is OSF. If you want to register and you want to be transparent about your scoping review, you can go ahead and register it. You have to formulate a search strategy and apply it in the same way. You have to perform the PRISMA in the same way. You might not do the quality assessment, although it's always better that whatever evidence you are taking, you should judge a basic quality. You can do the data extraction the same way, then the data synthesis also the same way, analysis also the same way. So there are just two steps which can be slightly different. Yes, but the review question can be slightly broader to know the whole scope around that topic. So you can do that. And you can formulate a team like that. Like in our this scoping review which we had done, although this is the primary team, but we had also added on the people from AIMS biotechnology department, and Dr. Vikram Saini and Dr. Kamini Gautam was also a part of it, because they would look at the methodological aspect in complete detail. So that's how you formulate a team. Apply. Yes, very interestingly, Dr. Mohit, before we all joined informally, he was mentioning about narrative reviews also. So here, this is specifically for him and all the people who are interested in doing narrative reviews. Our skills, once we develop, we have to use them in all different dimensions. So we have also applied those skills now in narrative reviews. Don't do the narrative reviews like I was doing, where I did not have a search, I did not have keywords, I did not have any other parameters pre-decided. Even for a narrative review, try to formulate a broad research question. This is one of the narrative reviews which is published like that. So this we published in 2017. So you should have a broad research question for a narrative review. Formulate a basic kind of a search strategy where you have basic MESH keywords, which is medical subject heading keywords with you. And you can formulate a basic Boolean terminology for it, or even if not Boolean, you can apply on different databases also. So even because for a narrative review also, you would like at least that all aspects of that particular topic are covered. So you'd like maximum views for there. You can fix a certain time frame. Don't fix like haphazardly I did because I was doing it alone. You can formulate your team even for this, and you all can fix a time frame. Okay, in 2 months' time, we're going to collect the evidence, and then we're going to start tabulating it and analyzing it. You should always tabulate the evidence, because in one go, when the reader is seeing your evidence, even for a narrative review, it's very easy for you to look at columns rather than look at text. So divide your columns or data extraction tables into participants, intervention, comparator, outcome. Make it a habit. Whether it is narrative, with its scoping, systematic, that is the way to go. You have developed these skills. Please use it in every way possible. And this is also for our postgraduates who have just begun with thesis protocols, who are going to submit the thesis. They are writing the review of literature. This is the correct way to write. Tabulate it, formulate a minimal search strategy based on keywords, and write that okay, I've used these keywords. These are the MESH words that I've used. These are the free text words I've used. And this is the literature that I've got. And also fix a time frame for it. And then after you've done all this, prepare a conceptual framework. This is the right way to even do a systematic review in these times. You have to prepare inclusion, exclusion, even for these studies. So what did I learn now? I have applied my skills in other dimensions also. So the original one are still there, but I've added on because I've started using the relevant softwares, the reference management software, Zotero. Extremely, extremely important. Please do not start any review, whether it is narrative, review of literature for your thesis, even a small manuscript, a case report, anything. Please learn these free softwares, whether it is Zotero or Mendeley. Please make it your life. Do not start any kind of research before you learn this, because this will reduce your effort to half. I am a live example of it. My 2014 systematic review took me 1.5 years again to prepare. I did not know of any reference management software till then. And now if I do a systematic review, it is within 6-7 months, or I'm not saying that's the only factor that's important in reducing the time, but it really saves your effort. So please learn any reference management software prior to starting a research. Grammarly is very handy. Anti-plagiarism softwares, because you have to undergo that anti-plagiarism even while you go for the manuscript. So I've learned all this. RevMan, Grade. So you can upgrade, keep on upgrading yourself. And I can also plan good quality research because I study now the quality of evidence in so many studies. Now, if I have to plan my own study, so I will be keeping those factors in my mind so that I plan a good quality search. So it's very important for that. This is a mind map that we have prepared, and we have registered it for copyright. This is DIY systematic review of mind map. So me and Dr. Aman had just conducted a workshop on systematic reviews 3 days back. So it was not registered for copyright till that time. So I had not shown this completely. But now since it's registered, so I know that I can share it with you people. And this is completely, if you see, all these steps are there. All the points are there, which you need to keep in mind when you formulate each step of systematic review. So this is soon, we are going to publish it. So it will be available for all, but you can easily refer to it. It can not only serve as a guide for you to go through a systematic review, but also as a checklist that, okay, have I done this step? Have I done this step? So it's also as a checklist. So this is a complete comprehensive mind map. Time to broaden my horizons. So now I disseminate and I connect now that I have gained a little bit of experience in this field, maybe narrative, maybe scoping, maybe systematic reviews. So now I conduct workshops and lectures. Some are in India, some are abroad. And I've had the chance before Corona to go to Seoul, IADR, also present my research, and also to Turkey. So this is a very amazing experience, because when you conduct these workshops or these lectures, they're not just for disseminating your own knowledge. It's for collecting the knowledge from so many different branches, from so many different fields, and incorporating that thing in your own research. That's what I said in the very beginning. I'm excited here not to deliver, but to learn from everyone. So I've also broadened my research or my area of interest to forensic odontology, and the same skills, as I said, I've applied in salivary signature and forensic profiling. So me and Dr. Aman have again published a scoping review. And this is a kind of a flow chart. Again, if you see, this is visual. This is the gist of the whole scoping review. This is how you're going to study the salivary signature and what is its importance. Everything is there in this particular figure. That's how you synthesize the result, interpret it, and make it available to the readers. From the scoping review on saliva and COVID-19, again, you can also broaden your horizon by creating derivatives. Now, since you've collected high quality evidence, and you can create derivatives in the sense that we created here, when we put forward a current dental perspective, and we published it again very recently. This was a 2021 article, and in 2 months' time, we decided to make it available for our dental practitioners, how they can apply that knowledge in their domain. So this is a emerging hot topic. It has been published again. So this is how, again, you can create the derivatives. And very important, this is a tip that I'm giving. It's never written anywhere. But whenever you write or you try to disseminate, even for a literature review or a scoping review or any review, it is always better that you create some flowcharts, some diagrams, some figures, and some mind maps for the readers to better understand your results. So like we've created this figure. These are all from our own publications. So this is how we create with every publication of ours, so that you don't just have to dry read it, all the results. You can easily just look at the figure. They can either tell you the results or they can enhance your understanding about the topic. So if you understand the difference, I'm coming to the end. I think I'll just take 2 more minutes. So this is the gist of it. So when you talk about speed, methodological detail, risk of bias, comprehensiveness, this is how the scoping, rapid, systematic review. If you look at here, more explicit method, decreased risk, it is more comprehensive. This is how it works. So what did I learn? Again, I added to my scientific writing aspects also. I added to my lateral thinking aspects also, and intellectual property right aspect also, because I know that I need to copyright a thing before I share. Trainings which are possible if you really want to go ahead in it: Prospero Handbook on Systematic Reviews, Revman Handbook, Cochrane Online Training, Professor B.V. Moses Training Institute, CMC Vellore. You carve your own journey. I've carved mine. I am ready to be a part of your journey. If you really wish, if you want to seek help or you want some guidance, I'm always there. And I'm always there to learn from you. So don't start alone. Have people with you, and then only you'll appear victorious. This is my team, and this question mark is who would like to be added here. This question mark, if I take to the left side, means who would like us to be added with their team. So we are all here to help each other. And are you ready to begin? This is my end slide. And this is a question that I've put on ResearchGate 2 days back before this lecture came up. So if you want to post your queries here, you can easily go to the ResearchGate, find me, and you can put your queries here, and we can look for answers together. Thank you so much for a very patient listening. I hope I was able to deliver a part of what I was supposed to deliver. Thank you so much. Can I stop share?
Yes, you can. Okay, we're going to ask our viewers on YouTube to please post your questions and your comments. In the meanwhile, I think, yes, Dr. Sachin, you can take the discussion here till more questions come in there.
Yeah. So first of all, I would like to thank the speaker for such a comprehensive presentation. And without further ado, I would like to start question and answer session directly from me. So first question, my question to Priyanka you is, how many minimum articles should be there to conduct a systematic review? Could you please throw some light on that?
Yeah. Okay. So anything that I talk here, as I said in my presentation, is just based on experience. So when I was doing research on obstructive sleep apnea, and I was doing a research on removable appliances in obstructive sleep apnea, I went through Cochrane systematic review. And you can't imagine that there were 14 RCTs that they started with. But when they finally gave the decision, it was just based on one good quality research. On two good quality research. So minimum number of RCTs, what I feel is that you should have at least two to start with. If you have more, then definitely it'll be a greater kind of evidence. But yes, you can conduct a good quality systematic review just based on two good quality RCTs which are registered on that particular topic.
Yeah, thank you so much. I think there are more questions on YouTube. So I will just ask one by one. So first question is by Dr. Krishna Sirisha. She wanted you to elaborate more on formulating research question.
Formulating research question, definitely, as I said, that we have to be very, very specific, and we have to be segregating them into the PICO format. We should know what is the participant, we should know what is the intervention, the comparator, the outcome. So, it is not per se that it has to be an interventional study only. You can have an epidemiologic study, you can have a prevalence study. So, but at least you should be identifying which population you are studying. And if you have a comparator for that population, then you should be writing that comparator also. And outcomes you definitely should be identifying in your research question, what you want to do. Like I said, that even in a mucormycosis, you can go in different dimensions. You can study the etiologic aspect, the treatment aspect, any other aspect, but you have to be very clear about your research question.
Yeah, I totally agree with you. Formulating research question is something, your whole journey of systematic review is based on formulating research question.
Absolutely. Totally.
And I also would like to one thing to that is that you should also think about adding novelty to your research question. So more is the novelty. So according to me, novelty is directly proportional to impact factor, isn't it?
Yeah, that is there. Now that you're completely right, because the publication factor, the citation factor, everything is correlated after that. Yeah, absolutely.
Yeah. So second question is again from Dr. Krishna. How frequently do we need to keep updating our SR?
Cochrane says that you should be updating it every 2 years, although that doesn't become a practical possibility. But yes, Prospero also encourages you to update your systematic reviews at least 4 or 5 years down the line. So we do not recommend that if you are doing a research topic and you have seen that some particular group has already conducted that research and it's very recent, maybe in the last 4 or 5 years, please do not do that research again, because they should be updating it. Or even if you want to update it, you can inform them and update it. But don't take the same topic. It will be duplication. It will be very early duplication.
Yes. The next question is from Dr. Rebecca Becky. Software for data analysis. Which software we should use for meta-analysis?
Well, I think RevMan is very, very comfortable in the non-Cochrane mode. If you do RevMan, I think it's really comfortable.
Yeah, also I agree with you on that. The next question, again, the next question is by Dr. Rebecca. She asked, suppose my review does not have any patient intervention, or say it just analyzing various studies and processes, a new conceptual map can it be still called a systematic review?
Systematic review is primarily based on systematically reviewing the evidence. If you have started with a clear-cut research question, as I said, you don't have to particularly stick on PICO, but your research question has to be very specific. If it's very specific and you are following all the systematic review protocols, why not? It is a systematic review. And you have observational studies for it. So we do systematic reviews on observational studies, or maybe the diagnostic studies. They are not directly related to the patients. They can be in vitro studies also. So it's not necessary. There is a huge dimension, but you have to follow the systematic explicit methods.
Yes, I agree with you on this particular aspect. So there are actually many praises and congratulations for you on YouTube comments rather than questions. So that itself says that your lecture was highly successful. So I think
you, Dr. Sachin, I think I'm really, really elated, because you are kind of, your amount of volume of work is just too much. So yeah, really happy.
Thank you so much. Over to you, Dr. Mandana.
Yes, I think now I will request our 3 guests who joined us, because they had specific questions, to come in and share whatever questions they have or whatever thoughts they have. Yes, Dr. Sangeeta?
Yeah, thank you,
Any
Dr.
questions you
Priyanka,
have?
for this wonderful informative lecture. So I joined here because right now we are in the process of registering 2-3 systematic reviews from our department, and this is for the first time we are doing systematic review. So I thought I will learn few more things. So while filling this form, while registering on Prospero, there are a number of questions actually, and some of those questions we find very confusing. Many a time at many points they have asked for inclusion exclusion criteria repeatedly. So do we really need to repeat our inclusions and exclusions so many times there?
And that's why when I put that slide of PICO, I had mentioned that when you do a participant, you prepare your Word document for Prospero in such a way that you have that inclusion and exclusion criteria separately for participant, intervention, comparator, and outcome. If you see in the Prospero document also, their inclusion and exclusion criteria are related to these 4 aspects only. Besides that, they will ask you about the quality assessment and everything. But yes, you can also do one thing, that you can go to Prospero and you can see if any similar review or just related topic is registered. So you can also see how they have written it, since you're doing it for the first time. But for your own self, since you have to be very clear that I want these studies and I don't want these studies, so you have to write the participant intervention comparator and outcome inclusion and exclusion criteria separately, and you have to enter it in Prospero separately.
Yeah, but it is repetitive actually. Number of times they have asked for inclusion, exclusion.
Ma'am, actually Prospero, we again take a full workshop because we point wise go through each step. But in general, if you see, none of their points will get repeated. Because if you have participant, it will be just pertaining to participants. If you have intervention, inclusion and exclusion criteria, just of intervention they'll ask.
Okay.
They'll ask effect size and everything. Yeah. Ma'am, but we'll definitely, if you really want, I'm there at my mail ID was registered in every slide. So I'll be really happy to help if I can.
Yeah, thank you very much. Actually, our first study, which we registered 4 months back, so that was not accepted by Prospero 3 times. It was rejected.
We can show that. We can modify it. No, we can modify it. There is no problem. In registration.
Yeah, so now for the 4th time we have sent it. Yeah, for the 4th time we have sent it with modification. Well, now we do not know what will happen. But I want to know whether there are any other registries for, for systematic reviews.
Yes, there are. One is Cochrane, which is the highest. You have to do a Cochrane, then you don't have to register in Prospero. There is Prospero. There is Jonah Briggs Institute also. But
they charge a lot. Jonah Bridge, their charges are very high. Yeah.
Prospero is, ma'am, actually, I can just, maybe you're going, because for Prospero registration, we never face that problem. Maybe we can see and we can discuss your study again and we can help you out there.
Okay, I'll contact you then. Thank you very much. Thank you very much. Yeah.
I think there are 2 questions from Dr. Mohit. I think he has got logged out somehow. One is,
I'm there.
Oh, you're there. Okay, then please join and share your question. Yeah, okay.
Ma'am, one of the question is that actually we had written a systematic review. I was there in another college that time, and it was on stress and cancer. It was something like a scoping review, but and there we gave one nice pathway for the role of adrenergic hormones on oral cancer. But then we sent it for publication and it got rejected badly. And, and the problem is that the review was done by the student and I was like the guide for her, and probably she has not done it properly. So is there any mechanisms to check? Because there are some universities which they have prescribed LDs to be done as a systematic review. So that's the problem people they are facing, is that since it is done by a student, we can take care of the quality of the work we are doing. But how to check whether the work done by the student is genuine or not? Because a lot of parameters here are involved. So that was a lingering question in my mind.
Mohit, there are two or three aspects that you've mentioned here. The first aspect I could understand is that the reviewer have sent them back. If the reviewers, if there are good reviewers and they send you back, like they change the course of my thinking altogether, I totally value those reviewers, because if they had not trashed my first article, I would never have gone into systematic reviews in the first place. The second thing that you were trying to say is that since the study that you are mentioning have been done by students, this is my earnest request to the PG guides, that we should not be telling the students, since they have just entered into research, and this is the highest quality of research, we should be telling them to go one step at a time. They can start with scoping reviews. They should not directly be starting with systematic reviews. They are bound to go wrong. Because since I mentioned you, I've shown you a mind map. There are huge number of steps that you have to follow. And the student are students. They can go lost anywhere. So let us start at some place and give them the right direction and the skills to finally progress to the systematic reviews. Definitely, after the whole study is done, it's very difficult to point out, okay, you went wrong here, you went wrong there.
Yeah.
But you have to control each step before you go to the next step. That is why the mind map is there.
Okay. Is ma'am, if we have some systematic review already published and we are interested to again examine that association, can we do that?
As I told you, that if it's an old systematic review, maybe more than 7-8 years, because a lot of evidence gets accumulated in 7-8 years, you can do that. There's no problem. But if you also want to publish an update, then you have to update is within 3-4 years. If you have to publish an update, which you don't publish the original articles that they have already published, you will just publish the 3-4 years update on that. So that then you have to inform the prior registered group. You have to inform them, and then you have to carry on with the update.
So we have to be very clear in telling them that we are trying to do an update on this topic.
Absolutely. You have to ask, you can ask their permission. People are very, research community is very open. They will easily give it to you because they'll get citations. They'll get a lot of citations for it. They'll be happy with you doing it.
Ma'am, could you just enlighten what is the difference between a scoping review and a systematic review?
Yes, as I said, that scoping review also follows the systematic methodology, but it is not stringent on the quality assessment of the studies, because that is where, students get discouraged. Okay, we have to do quality assessment of all the studies and separately, and they get discouraged at that point of time. And plus, you might lose on a lot of articles in quality assessment also. A scoping review is broader, so they want to include all the aspects of a particular topic. So they are not too stringent on the quality assessment, and they don't have a registration also. Like Prospero is a must for any systematic review, an international registry. It is not mandatory for a scoping review.
Okay, ma'am, coming back to my
method
first.
is same.
Okay, ma'am, coming back to my first question, like I asked that the systematic review we wrote on role of stress and oral cancer. So this the reviewers, they sent back with the comment to convert it to a meta-analysis. So how can we do that?
See, for meta-analysis, you should not have heterogeneity in studies. I mean, even if the heterogeneity is there, then it has to be analyzed statistically. So you have to isolate amongst that systematic review only. You have to isolate 3 or 4 studies which are having the same exactly the same methodology. They are looking at the same aspects. So, and they have quantification. They have numerical values to it, because they have to be statistically analyzed. And then only you can generate a forest plot.
So we cannot compare lung cancer and prostate cancer. All of it has to be lung cancer. All of it has to be in the oral cancer only, right? We can't compare those studies like that. Means if we are looking for certain molecular pathway.
Very broad thing. Yeah, then molecular pathway, then either you have the biomarker levels that they have mentioned in certain biofluids in blood or something. So you can, if you have those biomarker levels, then definitely you can perform a meta-analysis.
Thank you, ma'am. That's all from my side. Thank you so much.
Okay.
Dr. Priyanka, I
Purvesh.
have one. Yeah. Okay, sorry.
Yeah, yes, Sangeeta, go ahead.
Dr.
We have
Priyanka, I
just
have
a
a
few
question.
minutes.
Yeah. So while doing meta-analysis, as you said, it is quantitative figures are required, but methodology is same. But if the units of the quantities are different,
You have to
in
make it
different
similar.
studies.
You have to make it similar. The units, you have to make it similar before entering.
So can we convert those units?
You can. Why not? You can convert those units into a single unit. We did that for our scoping this time when we did saliva. So, it was difficult for me to understand what are log10 values and what are C values. So I was getting confused, and I looked into the conversion charts. Then I came to know, okay, this is higher, so this means this. And you have to go through all that.
So we can convert the units, right?
Absolutely.
Yeah. Okay, thank you.
Dr. Purohit, you have anything that you want to add? Anything you want to ask?
Ma'am, first of all, thank you so much for simplifying this topic to the level that I had so many questions in my mind. before this presentation, but all of, I think, approximately all are clear. First, one question I have right now, that are these systematic reviews are limited to the clinical trials only, or we can conduct it on non-clinical topics also, like in forensic dentistry we are
You can do
trying
it on
to.
observational studies also. You can do it on
Oh,
in vitro studies also. You can do it on
okay,
animal studies also. Prospero is even registering animal trials now, animal studies now.
okay. Because in forensic dentistry we are trying to develop new strategies and new techniques every day, so a few researchers are doing in this way and that way, just to get to know that what kind of research can help in future, so it
So
can be
you
applied.
did, Dr. Manu, did you recall my resident A? Now he was also trying 2 or 3 different techniques, and he was trying to find out which is the best one for his patients. So that's what it is all about.
Okay,
Becoming the
okay,
resident A.
Okay, I think we
okay.
should begin wrapping it up. Now I'm going to
Ma'am,
request, yeah, no,
Vandana, ma'am.
yes, who's
Ma'am,
speaking?
there is one question. This is
Okay,
Dr.
Dr.
Sachin, ma'am.
Sachin. Yes, please go ahead.
Yeah. There is one more question on YouTube. So
Yeah.
this is slightly, kind of unconventional question asked by Dr. Arvind Babu. He is an oral
Okay.
pathologist. Yeah,
Hmm.
well-known oral pathologist. So I think let's see how we
Yeah, please go ahead. You can read the question.
contribute in terms of answering it. Yeah. If any private practitioner needs to involve in research, what is the source for them to get ethical clearance? Apart from university, any other source there to obtain ethical clearance? So good, interesting question, ma'am.
Yeah,
Very.
actually, you know, the articles which I have just come through, they just mention the Helsinki guidelines and they follow the Helsinki guidelines. But specifically, maybe, if I don't know something, I would not say that I know it for sure. I do not know if private practitioners have to register, then they have to register for ethical clearance in which maybe you can involve some maybe researchers from institute and they can apply in their own institute.
Yes.
But really, yeah, that is one question that I'm not directly, I would not be able to answer. But Gurkeerat sir is here and he's managing both the fronts so beautifully. I think I am going to hand over the mic to him now. So
Thank you, Priyanka. Actually, I'll put it very simply. You see, what Priyanka has highlighted throughout the communication today is that we have to have a team. So even if you are a private practitioner, ultimately this is a team sport. So if you're thinking of doing a systematic research on your own as a private practitioner, might as well pack your bags. Otherwise, you have to be really, really dedicated, and you should maybe after an 8 to 10 hour clinical work be ready to sit in front of the computer for another 3 to 4 hours a day, which is practically impossible. So my advice to anybody who really wants to get into research is to formulate a team where he is comfortable working with that team, delegate duties, and then go about it. That's the only way to do research, being in private practice or even as an academician. I can assure you that everything is not our forte. I mean, statistics, I might not be good at statistics. So I need to have a statistician, or I might not be good with one topic. Today, what Priyanka is doing is basically because she has streamlined her methodology. So anybody who wants to get associated is basically asking her the methodology. So I mean, I'm very sure that we all have enough articles and enough material, and access to that material is also quite easily available considering that we are in a digital world. But the methodology and the steps to follow are the key to any good systematic review or a scopus review or a meta-analysis or anything of that sort. So the team is the highlight of the lecture. I mean, that's the take home. Please understand that and then work accordingly.
Very well said. And I think now I will just. Okay, I think Dr. Karpuka Selvi has put a comment there, which I think answers this. also is that any institutional ethics body within 50 kilometers you can register your
Excellent.
study with.
That is new
Okay, so that
information
is,
for us.
yes.
Yeah, thank you so much.
Yes. And that is there. Then we have one little aside from Dr. Nasser Said Al Naif, because we were talking about the reviewers' comments and how it can really make a difference. Well, he has put a little aside, which I agree, and it is not always the same for everybody. So a lot of it really depends on the experience of the reviewer.
Absolutely.
So, I mean,
Because
that
as
also has
I
to be,
think,
yes.
yeah, I think the one who asked me the question about this, I think Dr. Mohit only asked that the reviewer was probably a student or somebody with a low. But these days, whenever the systematic review reaches the journal, they have their set panel. Okay, these people are there for systematic reviews. Immediately, they get transferred to those reviewers. It is very rare that you send it to a novice or somebody who has not done it.
Yeah.
Very
So,
rare.
it's a combination of all that. Now, before we wrap up, I have this thing where, now we got all the science in place, all the technology in place, all the methodology of collecting a good data in place. But at the end of the day, I think any knowledge is a total waste unless a person who it is for can consume it, can understand it, and can make the best of it. So I think after any review, however good it may be, however the content may be, it's very important to put it down in also and equally in a language that can be understood and used by the people. And today we have the opportunity and the good luck of having a very well-known author who I'm told his ortho books are like perfect for students and anybody can understand. I wish I had one when I was a student, but anyways, so today I'm going to ask him, how did you manage that? How do you convert information into something easily understandable?
Thank you, Mandana ma'am. Basically, I'll tell you two things. One, I did not start out to be an academician. Okay, I started out as a private practitioner, and we were never taught how to do consultation, right? We were never taught in college. We had abundance of patients, and just think about it, 25, 30 years back, there used to be a queue to enter an ortho department. Even if you were a postgraduate, you were queuing for that post to get into that department. And even if you were a student or a patient, you were definitely on the waiting list. Nobody could just enter and get treatment started. So when I came into private practice, the first thing that I had to learn by myself was not to use technical postgraduate language in communicating with the patient who just understood if his teeth are front or back or maybe malaligned, but the word malaligned could not be used. I could not use a word called malocclusion. That is where the simplicity comes into the play. So you have to talk in a language which is communicable to whoever your audience is. So let me, again highlight this, that Priyanka communicated to us in a very simple language. And that is why maybe, most of us were glued onto our screens because we understood what she was trying to communicate. The charts, yes, we will have to go through those charts to understand what it is in detail when we start writing a review, but we should know the path. So now we know a destination, we want to do a systematic review or we want to do a meta-analysis or anything. But now the path is clear, and then you will have to follow that up as you go along into your designated field of interest. That's one thing. So always my contention has been to talk to an audience. It might be through a book, it might be through a lecture, it might be through now webinars, but you have to be able to communicate what you want to do for the patient. So if I'm going to use high tech language in front of a patient, he's going to look at me with bewildered eyes and maybe walk out and go for a second consultation. In today's world, it's easily available, right? So the same thing comes down to academics. If you want the child to understand what you're talking about, and talk to the child in a language that they are comfortable or able to understand. So it might be an undergraduate, it might be a postgraduate, but remember the basics are always required. So if your basic knowledge and information is right, you can always talk any level of communication. Coming down to systematic reviews in particular, yes, they are very high on the level of evidence, but they also started with the story that Priyanka told us with a case report. So everything that we ultimately see in any research, any randomized clinical trial, anything is basically out of an observation. So don't negate your observations. Try to prove that your observation repeatedly produces a result which is applicable in day-to-day practice. So that is how I take reviews, with a pinch of salt, remembering that my observation skills need to be polished every day with every patient, with every time I meet that patient. And then I need to gather that and use that with clinical acumen and research topics to be given to postgraduates or to other researchers, and to share that knowledge and make it a flow chart that if you have this problem, this is the protocol to follow. Protocols will be given by this high-end research, yes, but the groundwork is still going to be done by that clinician sitting in that practice and doing the same work repeatedly. So yes, systematic reviews sound very scary, but they are not that scary. They are just bits and pieces where the bricks came together and made the wall. So you just have to keep on putting your bricks together, and the wall will come through. And some people are very good at building walls. Priyanka for being one, Dr. Sachin being another person who's got multiple reviews in place. And I'm sure Dr. Mandana would agree that it is these people who lead us and, kind of give us the incentive to get works published, I would say, which is at times tough. So get your bricks together and the wall will come through. That's the take home. Thank you so much for asking me to be here and for the wonderful presentation and the, moderation as well as the hosting of the whole symposium. Thank you so much.
It's very kind of you, and thank you for being here. That really made a difference. Now, just to wrap up, Dr. Sachin, you want to add anything? You want to any wrapping up comments from you? I think we have lost Dr. Sachin.
I'm really,
He's gone.
impressed by the way sir has given his insight. Am I audible?
Yeah. Yeah, Dr.
Yes,
Sachin, we
yes,
can hear you.
yes, you are.
I'm really impressed. I'm really impressed by the insight about, observation. Observation is the key. And along with observation, if you want to discover, if you want to come up with a good research question, it is all about imagination. I believe that any innovation, it involves 90% imagination and only 10% knowledge. So I really, really impressed with sir's point of view on his observation skills. So that's it I want to add for today's presentation. And I would like to congratulate Dr. Priyanka for such a comprehensive presentation. Thank you.
Thank you, Sachin. It is finally, I think at the end of the day, it's always a good thing to just sit back and remember what we are doing all of this about. What is all of this for is for patients. It's eventually always circles back to managing a patient, to taking care of a patient, to ensuring health persists, or if there is any illness, we can rectify it or treat it. So that's what I would say, the first step, the ground, the absolute foundation stone of everything. And very well put by Dr. Gurkeerat, very well put by Dr. Sachin, and of course, Priyanka, marvelous presentation. Absolutely great. I knew I would enjoy it, and I did. Thank you so much.
Thank you so much.
Yes, and I'm going to now welcome.
Thank you so much.
Nice.
Thank you so much.
Thank you. I shall now have to just share my screen. Yes. Have we got this?
Yeah.
Is my screen visible? Yes.
Yes.
Okay. So thank you, Priyanka dear. This was fun planning. It was fun chatting with you, and it was definitely fun listening to it.
It was fun holding this talk and discussing with all of you. Thank you so much.
Thank you. And as of today, our certificates, your digital certificate, which I will send to you, has a little additional thing, that picture at the bottom. It has a direct link to the video, so it will always be available to you in the future too. So with that, let me go to the next. Yes, thank you, Dr. Sachin. It was nice of you to make time and be here with us. Sometime back I heard a lecture, somewhere he was presenting a lecture and someone mentioned that he is the Sachin of oral pathology. And I think in India, that's quite something.
Thank you, ma'am.
You're most welcome. Thank you for being here. And then, of course, Dr. Gurkeerat, it was really wonderful having you here. Priyanka had told me actually that it will be really fun having you and talking to you. And I must say, you have totally lived up to that expectation and very informative. Thank you so much.
Thank you so much, ma'am.
Thank you. Now, also, of course, thank you to our three guests who took the trouble of filling up a form in spite of much confusion. And I have rarely caused as much confusion by sending out a form, but this time I seem to have caused a lot of confusion. So anyway, this was good. Some filled the form and Dr. Priyanka kindly chose the persons who could at random. So, and they came here and they also contributed. Thank you for being with us.
Thank you so much, ma'am, for
Thank you so much.
You're
ma'am.
most welcome. You're almost welcome. Now we have our announcements for next week. So we are starting a new series on the channel. I think this has been way long time coming. It's the clinicopath case discussions that will review multiple cases of a single entity by one organization. It is from diagnosis to treatment. And of course, it is but natural. We will be starting with mucormycosis. And that is from coming to us from the Maulana Azad Institute of Dental Sciences. And you will have to put reminders. And I hope you will join us. And there is also one more thing next week on Monday, our Oral Pathology International Association meeting is starting. And this time it is it's a great opportunity because registration is free. Now we know normally to attend the international meeting costs quite a packet, both for the registration and the traveling and stay. And this one is literally coming to our homes. I do hope everybody has registered and I do hope you will attend and also share it as much as you can. I'm going to say this finally, this is a channel which is not just about putting oral pathology in perspective with every other part of dentistry and patient care, but it is also very much to advocate oral pathology and to promote oral pathology. So please share this with each other. Put a hashtag oral pathology and share it as much as you can. And also attend it. It will be very interesting. And the timing for us in India is good. We definitely can attend at least half. Is from 5:30 in the evening till 10:30. But I think we have audience from the US. We have audience across Europe, Africa, and Asia. And I think most of all of these four continents can attend very easily. Probably only our colleagues in New Zealand and Australia will find this like in the middle of the night. So they'll probably miss it. But anyway, with that, thank you so much. And thank you everybody for being with us. I do hope you will join us again next week. Have a wonderful week till then.
Thank you, ma'am. Thank you, everyone.
Thank you. Thank you.
Thank you so
Thank
much.
Thank you all.
Thank
Thank you,
you.
everyone.
Thank you all. Thank you all.
Thank you, ma'am.
Thank you, Priyanka.